Mira Ihalainen is the Resource Mobilization Specialist in the United Nations Population Fund, UNFPA, with a portfolio covering gender and health-related partnerships, as well as financing for sustainable development post-2015. Prior to her current position, she has held various positions in the UN system, with a focus on gender equality and women's empowerment as the UN Women Africa Program Specialist based in New York and UN Women Program Manager in Ethiopia. She has been coordinating evidence-informed work on HIV by the UN system as UNAIDS Management and Organizational Development Advisor in Ethiopia and Institutional Development Advisor in Kenya. As a program manager in UNICEF, covering gender, FGM, and HIV programs for Somalia, and coordinating UN humanitarian action in those areas. As a program manager officer in UNAIDS, coordinating advocacy and programming for young people. Before her UN career, Mira briefly worked in the academia and civil society. She holds a master's degree in politics from the University of Namibia and has undertaken postgraduate studies in psychology and public health. I welcome Mira to have her speech.
Thank you very much. And I'm going to take a leave out of Marilyn's earlier speech and wish you a varadepo nawa and hyvää huomenta. So wishing you a beautiful morning in two of my languages. I'll let you guess later which the countries are. Okay, so I think in terms of my speech, I'd like to say I think the film is the keynote. And I will speak to it and around it. Because I think for a lot of issues, and I think Fistula is definitely one of them, seeing and hearing the first-hand experiences speaks more than 1,000 words that I could say here from the podium. And I think that is generally our experience, that when people know about Fistula, they are moved to take action. And I'm really humbled and honored to be here this morning speaking to you, so many of those who have been moved to take action. And I'd like to very much thank you all on behalf of UNFPA for partnering with us, but more importantly, for making a real difference in the lives of women who have been affected by Fistula, their families, and their communities. Can we have the next? Okay. So I will talk to you a little bit about the global campaign to end Fistula, which the Liberia project forms part of. And basically, one of the founding kind of observations is that obstetric fistula is a neglected health and human rights tragedy. And why we say that is that a lot of focus has gone on fighting maternal mortality and looking at kind of issues where we say no woman should die giving birth. But at the same time, we need to focus on also key issues that cause maternal morbidity. So while no woman should die giving birth, they also should not be left with a debilitating condition that affects their lives. Sure. And less focus and information is generally available on these conditions. At the same time, because obstetric fistula doesn't a lot of times, it doesn't result in death, so it doesn't result in reliable, systematically collected statistics. So a lot of times when we talk about obstetric fistula, we talk about our best estimates in terms of the statistics. And in many contexts, it's a very difficult subject to talk about because obstetric fistula is very much linked to kind of concepts of lack of development, because it does mean that we're fundamentally failing the women in provision of very basic, safe birthing-related services that they deserve. And this is why for us it is a human rights related issue. So to address these issues, in 2003, the campaign to end fistula was launched, and it is a global partnership covering, basically has a global coverage and to bring focus on these issues. And ultimately the vision is to make fistula as rare in all countries as it is in the industrialized world. But we're far from that, because at the moment, the backlog of cases that exist is actually growing, even if the partnership and the efforts to address obstetric fistula are also growing. For some of us working in New York, where we use a lot of times as an analog for this, what we'd like to do is that some of you may know that there's a very famous hotel there called Waldorf Astoria. But what many people do not know is that Waldorf Astoria used to be the last fistula hospital in New York. And it's a very beautiful building, and we think it's in much better use as a 5-star hotel. And ultimately, I think what we'd hope is that in every country, the fistula hospitals could be put into different use when they're no longer needed. So working on obstetric fistula is both exhilarating and frustrating. It's exhilarating because you can really see the difference. You can see the smiles, you can see the people, you can see the transformation of lives. At the same time, it's frustrating because it's one of those things where we know what needs to be done. It's not guesswork. We know how to integrate the key services into health sectors and maternal health services, because ultimately that's what we want, that we don't get new cases. But we also have very effective treatment for women who are affected by obstetric fistula. So regularly, success of surgery reaches 80 to 90%. We also know that the holistic approach works, and we know that especially for women who have been affected by obstetric fistula for some time, they need also services, psychosocial services, and support in integrating them back into their communities and being economically productive. And we also know that we need to also address the needs of that small percentage of women who cannot benefit from surgical treatment. So that's why it's frustrating that we can't do it immediately for everybody. At the same time, if we think about the impact of working on obstetric fistula to the overall development agenda, we also have evidence to show that it has much broader positive impacts, in that it allows the women to basically take their rightful place in the economic and social growth of their countries. And at the same time, we also know that when they are able to do that, the spending patterns of women mean that their household statistics on nutrition, on education, on basically a lot of areas of social development are better. So supporting women with obstetric fistula means also positive impacts to their households and to their communities. So I'm going to cite some statistics shortly, but more than numbers, what I really want you to envision are really the different women, the different stories behind them. Whether it's a woman who, after living 30 years with obstetric fistula, undergoes successful treatment, and her first words are, "Now I'm free," or "Now I am back to the person who I was meant to be. I got myself back." Or whether it's the young woman who, in a very short period of time, goes from being an expectant mother, waiting to welcome her first child, to not only mourning the death of her child, but also having this debilitating condition and being shunned by her family and her community, mainly because of lack of knowledge. Or the woman who, after having been 10 days in labor, is brought in a wheelbarrow to the hospital and is able to receive the treatment that she needs. or the many women who have actually been treated themselves and who become activists for obstetric fistula. There. Okay, so I'm not going to talk more about the fistula campaign. You can visit the website and see that it really represents the collective actions to address the needs of the estimated 1 million women living with fistula in the world today. And it does include almost 60,000 surgeries carried out in over 200 facilities in over 40 countries. And these numbers are going up by year. So the Liberia project, which you all know and which we've been working together on. So in that program, over 1,000 women and girls with various types of fistula have undergone surgical treatment. And while the most common type of fistula is obstetric fistula, in many of the contexts where the programs happen, it allows also the treatment for other types of fistula, especially in post-conflict and conflict context. There is quite a huge prevalence of traumatic fistula, which is fistula which is caused through aggravated sexual assault. So the investment and the skills and capacities that go into obstetric fistula help also to address other types of fistula. And close to 250 survivors have been rehabilitated and successfully integrated into the communities. And then, following the holistic approach, what Sonia mentioned, basically overall there's a larger awareness in the community that facilitates more effective response to the issue in the future. Okay. Still, a lot of challenges remain, and this is why we hope to continue the partnership with Zonta International. So there is a backlog of more than 5,000 cases still. And what happens in fistula responses when they expand is that you get kind of the low-hanging fruit first. So women who live close to hospitals, who are in the urban areas, where communication and awareness picks up much quicker. And as we proceed, then it becomes more and more challenging to reach women and their communities. So this is also why the backlog still exists, and that work needs to go into identifying and being able to treat the women. And I mentioned also that some of the biggest problems are the insufficient financial resources and also building the capacity of human resources to effectively address the treatment needs of the women. So the 6 strategies, and I mentioned that we pretty much know what to do, and there is a consensus in terms of what a good response to fistula should look like. So as a holistic response, it does include, in terms of being able to make sure that ultimately we move towards prevention, is to make sure that obstetric fistula is integrated into the maternal and child health services in every country. This is the main difference why in industrialized world fistula is practically eradicated. It is really the access to these basic services for women. And scaled up treatment and making sure fistula surgery is a very specialized skill, and the medical staff that are trained in it also basically that is an asset for them that allows them also to be very effective in other types of surgeries, but that we have that quality present in the communities. And then the whole communication and partnerships aspect, and making sure that after treatment, also there is follow-up. After surgical repair, women are still, in terms of subsequent pregnancies or other obstetric events, they have a higher risk of recurring fistula. So they need to be followed and monitored. So as the outcomes for the 2014-2016 period, the hope is that over 400 women and girls will have received treatment, and over 100 inoperable survivors will have been identified and empowered. And at the same time, that the broader community-based approach will contribute significantly to the reduction in new cases. That's something that is very difficult to attribute to one project, but it does play a big role and plays that role beyond just addressing obstetric fistula. And at the same time, through that community awareness, through the advocacy and communication components, the project impacts the lives of much broader group of women in reproductive age. And the estimate there is 300,000. And just to conclude, very quickly, in terms of at the global level, to support the community action, that really is the key. We do, every second year, the Secretary General of the United Nations launches a report on obstetric fistula. And the last report resulted into 23rd of May being assigned as the International Day to End Obstetric Fistula. At the moment, the theme of the global campaign and the next ask looks at tracking fistula, changing lives. And the ask is to make fistula a notifiable condition so that governments as key actors will basically have better statistics available and then incorporate obstetric fistula into planning and find also resources for it. But in the meantime, it really responding to fistula is really an effort that requires the international community, civil society, as probably as the biggest player, so that we can really support the women. And if we believe in international development that has human rights and equality at the center, there aren't many better investments than investing in supporting the work on obstetric fistula. Thank you very much.